everyone. For those of you that don't know me, my name is Dr. Brian Worden. I'm a board-certified ear, nose, and throat surgeon and the developer of the Alleviate Integrative Tinnitus Therapy Program. I've been receiving quite a few questions recently about whether there are any promising new treatments for hearing loss and tinnitus in the pipeline. So I thought I'd put together a brief video to let you all know about some therapeutics in development that I think have some real promise. So a number of research groups are working on methods to regenerate inner ear hair cells using techniques like gene therapy, stem cell therapy, and small molecule medicines. And the hope is that restoring the underlying hearing loss, no matter how mild it is, will help reverse the maladaptive neuroplasticity that produces the chronic tinnitus. So one of my med school classmates is the chief scientific officer at Akuos, which is now part of Eli Lilly. And this is a company developing targeted gene therapies for hearing loss using a modified virus that's injected into the inner ear to deliver functional genes to people with certain genetic forms of hearing loss. And in their initial trial, they demonstrated the ability with this therapy to restore usable hearing to an 11-year-old girl who had suffered from profound sensory neural hearing loss since birth. Their plan initially is to use this technology to treat people with genetic forms of hearing loss related to a single dysfunctional gene. But the same approach could be presumably used to introduce modified genes to the inner ear that would promote hair cell regeneration to help people with more common forms of hearing loss like age-related hearing loss or loud noise-related hearing loss. 3 other companies called Regeneron, Sensoron, and Refresh Gene Therapeutics are using a similar approach and have also reported promising initial trials in humans with a specific form of genetic hearing loss. Now, another company called Sound Pharmaceuticals is testing a novel medication called Epsilon for the treatment of Meniere's disease and noise-induced hearing loss. Now, this medication, which can actually be taken by mouth, improves the function of a particular antioxidant enzyme called glutathione peroxidase in the inner ear. A press release from the company indicated that a phase 3 clinical trial of their medication produced significant improvements in hearing loss, tinnitus, and vertigo among trial participants with Meniere's disease, though these results have not yet been published in a peer-reviewed journal. Another company called Rinri Therapeutics has developed a stem cell therapy aimed at replacing lost or dysfunctional auditory neurons in the inner ear, and they are supposedly aiming to start clinical trials in humans in the United Kingdom sometime later this year. Dr. Hamid Jalilian's team at the University of California, Irvine is working on developing techniques to electrically stimulate the intact inner ear as a treatment for tinnitus, but this work is still in very early stages. There's also much evidence that imbalance in the autonomic nervous system plays a significant role in tinnitus-related distress. So I think there's real potential in interventions that help shift the autonomic balance towards the parasympathetic nervous system. Now, this includes non-invasive treatments like meditation and breathing exercises, but also more invasive therapies like stellate ganglion interventions or vagal nerve stimulation. It turns out that stellate ganglion blocks, a procedure in which a nerve-blocking medication is injected into one of the clusters of the sympathetic nervous system neurons in the neck, were attempted as early as the 1930s as a treatment for Meniere's disease, and at that time had mixed success. A couple of more recent published case reports, however, have documented successful improvement in sudden sensory neural hearing loss with a stellate ganglion block, even in one patient who previously failed steroid therapy given as both pills and ear injections. It's not totally clear how a stellate ganglion block is affecting the inner ear, but a leading theory is that it may be improving cochlear blood flow. Now, in the treatment of tinnitus, Therapies of this type that suppress the sympathetic nervous system or stimulate the parasympathetic nervous system also have the potential to downregulate the overactive stress response that contributes to many of the most bothersome symptoms of intrusive tinnitus. As the technology of cochlear implants improves, I also think it's likely that some centers will offer cochlear implantation as a treatment for severe tinnitus, because up to 45% of patients report total resolution of tinnitus after receiving a cochlear implant, and most other patients report a significant improvement in their tinnitus. Now, the downside of using cochlear implantation as a treatment for tinnitus is that insertion of the electrode into the inner ear most often causes some damage to the delicate inner ear hair cells, leading to a degradation of residual natural hearing in at least 70% of patients. However, as technology and the surgical technique have improved in recent years, we are seeing better outcomes in hearing preservation with this kind of surgery. So, to put it all together, I think there are some promising treatments for both hearing loss and tinnitus in the development pipeline. But we have to temper our enthusiasm because in reality, only about 10 to 15% of medical treatments that are tested in phase 2 clinical trials ever ultimately pass FDA approval and make it to the market as an available treatment. And unfortunately, it takes, on average, about 5 years for a promising medical treatment to progress from a successful phase 2 trial to FDA approval and availability in the healthcare market. So, while there is hope that one of these treatments discussed today will eventually be available to all of you suffering with intrusive tinnitus, that promise is still uncertain, and in the best case scenario, several years away. For now, the best available treatments for tinnitus are aimed at encouraging healthy rewiring of the brain so the brain can more easily tune out the bothersome sound. And the good news is that such treatments available right now are very successful at significantly reducing the burden of tinnitus in the vast majority of people. At Alleviate, we offer a multifaceted online and app-based program based on years of clinical research, and our approach has already helped thousands of tinnitus sufferers quiet their tinnitus and reclaim their quality of life. So if you're interested, check us out at www.alleviatetinnitusTherapy.com. So thanks for watching our video. If you find this content helpful, please like and subscribe to our channel. And if you have questions or comments, please leave them below. I love to hear your feedback and to interact with our subscribers. So thanks again and have a great day.